We all know that smoking is harmful to us, but what are the real costs to the world?
In 2012, $9.17 billion were spent on advertising and the promotion of cigarettes. More than $156 billion are lost in productivity due to premature death. Productivity losses from secondhand smoke exposure is $5.6 billion. In 2015, the United States will collect $25.6 billion from legal settlements dealing with tobacco, but will only spend $490.4 million, less than 2% on prevention programs. $3.3 billion, or 15% of $25.6 billion, could allow every state to meet the CDC standards.
Sarah Bernstein. I'm a registered nurse that works in the emergency room. Most of the patients that I see in the emergency room that come in with a habit of smoking come in short of breath, have a history of COPD, which is also known as chronic obstructive pulmonary disease. They come in and can't breathe. They end up being put on BiPAP machines, which help force pressure into their lungs, making it not as difficult for them to breathe. They're increased risk to have stroke. They have high blood pressure. They have coronary artery disease. They have cardiovascular disease, peripheral vascular disease, where the blood flow isn't very good to their extremities. A lot of patients I've asked to why they smoke, they say it's a habit that they can't seem to stop. It's not easy to stop because of the addiction to it, knowing all of the symptoms that can be caused from smoking. The average cost of a patient coming in through the emergency room due to their smoking habits can be around $20,000 for just one visit. That includes x-rays, blood work, respiratory therapists coming and doing treatment, the staff, doctors that are working in the emergency room coming to see the patient. That alone is just approximately about $20,000. Most patients that come through the ER with COPD exacerbation are typically admitted to the hospital. So there's an additional cost for the hospital visit on top of whatever the ER has charged.
Tobacco is the largest preventable cause of disease and premature death in the U.S. The total economic cost of smoking is greater than $300 billion a year. Approximately $180 billion was spent last year in direct medical care. The U.S. spends around $7,000 per smoker per year between healthcare costs and productivity losses. There's approximately $35 in health-related costs per pack of cigarettes.
Hi, I'm Dr. Alan Katz. I'm a radiologist, and I've been practicing here in St. Petersburg for approximately 42 years. And as a radiologist with a hospital practice and in a private office setting, I see many patients who are smokers, and I do lots of studies and procedures on patients who are smokers because of all of the illnesses associated with smoking. It's very hard to talk about all of the diseases caused by smoking in a minute because there are so many diseases. And it's very hard to say what part of the body or what organ system is affected adversely by smoking, because it's every single part of the body and every single organ system. The thing that most people think about is cancer, and mostly they think about cancer of the lung, which is a terrible disease. But in fact, smoking causes other cancers, many other cancers, including cancer of the bladder and cancer of the head and cancer of the neck, and you can keep going on with the list. But in addition, smoking affects every artery in your body. So what parts of your body have arteries? Every single part of your body. So people who smoke over long periods of time can develop insufficient blood flow to their legs, and every step that they take hurts for their whole lives. It's a terrible existence as you get older, living with the pain of smoking. And the pain also extends to breathing. Even without a cancer, you can get emphysema and chronic obstructive lung disease, and every single breath is painful and difficult. People are worried about the way they look. Well, there are arteries that go to the skin, and as a result, if you smoke over a period of time, your skin is going to age and it's going to look really bad.
On average, a pack of cigarettes in the US costs around $6.36. A 10% tax increase on cigarettes resulted in 4% sales decrease in high-income countries and a 5% sales decrease in middle to low-income countries. New York has the highest tax per pack in the US at $4.35, and Missouri has the least tax per pack at 17 cents.
This table shows the daily, weekly, monthly, and annual cost of smoking different amounts of cigarettes.
People who choose to smoke are making a decision that affects the health of others as well as their own. In the United States, knowledge about the cost of tobacco-related illnesses have led to a movement to create a smoke-free society. In fact, one of the goals of Healthy People 2020 is to reduce tobacco use. Medical research shows that any exposure to secondhand smoke can cause health problems. According to the U.S. Surgeon General, the only way to fully protect people from the dangers of ETS is to ban smoking in public places. Exposure to secondhand smoke causes an estimated 41,000 deaths each year among adults in the United States.
States and local communities are also supporting efforts to create a smoke-free society. Laws now prohibit the sale of tobacco to minors and the use of tobacco in hospitals and airplanes. In addition, some states have successfully sued tobacco companies. The money awarded in these cases may be used to fund anti-smoking campaigns or to offset the medical costs of tobacco use. Finally, community activities that promote a healthy lifestyle give everyone the chance to be a role model for avoiding tobacco use.
Advertisements aimed at young people encourage them not to smoke. Public service announcements encourage parents not to smoke near their children.
When you ask about the cost of smoking, you have to ask who's paying the bill and what it costs the person who's paying the bill. Well, of course, the cost which is most prominent is the cost to the smoker. Not only in terms of shortening his life or living a painful life, but also the smoker has to pay for his medical expenses. And the medical expenses can be very, very high. The total cost in the country for diagnostic tests and treatments for the complications of smokers is in the billions and billions and probably trillions of dollars. Just an unimaginable expense. So the expense is not only, however, the financial cost to the person who's paying the bill, it's also to the employers of the smoker. Why? Well, because the smoker is going to be sick more often. He's going to have more sick days. He's not going to be able to function as well as a non-smoker. And so there's going to be loss of labor and loss of productivity by that worker. So it's a cost to the whole society in that sense, and in that we're losing out on that productivity. And of course, if the patient is not paying the bill, if the smoker is not paying the bill, then somebody's paying the bill. And that could be the government through Medicare or Medicaid, which means through all of us, the whole society, because who gives the money to pay Medicare or Medicaid? Every one of us does. So the cost is to all of us.